This is Ray, who started off the Anyone's Mental Health podcast. Ray Elliott. Ray, where did it all begin?
Um, so essentially, I wasn't working in a mental health capacity. I was working in construction, have done for about 20 odd years now. And I was working as a health, safety, and wellbeing manager. And we were putting on some road shows where we were getting guests in, do talks to the lads on the site and whatnot. And during those talks, there was a lot of people reaching out for help. And I started to realise quite quickly that this was a big issue, particularly the far northern you went. And then I moved into a role working in mental health. So I now work as a public speaker, going around construction sites, talking to trades, talking about my own lived experience, um, and letting them know that there's help out there if they need it. But then you start looking more regionally. So I'm a northeast lad, born and bred, love the place, love the people, love the culture. But we're really struggling up here in the northeast. Mental health statistics and suicide statistics in particular are shocking, some of the highest in the UK. So that is why we started Anyone's Mental Health. It start the conversation, get people talking about mental health, let people know that there's things out there, resources, people doing some fantastic work in the wellbeing field.
You're just telling me, David, before about the stats
Yeah.
on suicide rates. Could you tell a little bit more?
Yeah. So particularly around construction, I mean, we're talking about the northeast, and there's a lot of statistics we can talk about there. But given where we're at in the crowd we're talking to today, construction workers, the statistics for mental health in construction are by far and above the worst out of any industry. So this charity behind us, the Lighthouse charity that we work very closely with, are doing some fantastic work to try and break down the barrier and the stigma around mental health, and offering some fantastic support. And that reason is because they've done some research in 2021, and they looked at the 12-month period. And in that period, um, they found that there was 506 construction workers in the UK and Ireland died by suicide. 504 of them were men. And statistically, you're nearly 4 times more likely to die by suicide than the general public. And why is that? What is it with this industry? Why are they struggling so much?
What do you think it is in this industry? What's causing so much stress, anxiety?
Um, I've got a few theories that I've got. I mean, firstly, and this is from experience, having been in the industry and worked as a tradie, I know when I was struggling and I was in sort of I was in a crisis situation, the thought of coming to work and talking about the things I was struggling with was the last thing on my mind. It just wasn't an environment that was conducive to talking about stuff like that. You talk about anything else, talk about all the stuff you've been up to on the weekend, but you never talk about the things that are really bothering you. And I think as an industry, we struggle with that. Male dominated industry, I think we struggle to talk about the things we need to be talking about, the things that we're really struggling with. So I think there's an issue there. Um, and it is quite a unique industry. It has some unique stressors. So we're often working on tight margins, weather, the actual physicality of the work can be contributing factors, and there's various other things that people are looking into now. But it's certainly an industry that's really struggling.
And people, the fantastic podcast that you do, Anyone's Mental Health.
Thank you.
So if you are struggling and you don't, you should reach out to speak to someone. But in the meantime, just listening to the podcast and what you
Yeah,
talked about in the podcast can go a long way to taking the next step and contacting the number that's on the side of that van.
absolutely, absolutely. I mean, it starts with conversations, doesn't it? That's breaking down barriers,
We've
breaking
seen
down
it today,
stigma.
haven't we?
Yeah.
We've seen it today. And obviously it's very personal and very private. So we can't go into the conversations that's happened today. But they're absolutely shocking.
Powerful stuff, though.
Powerful stuff like.
But once you give people that space and it's real, and there's a connection there, and it's on a human level, you've seen today some of the conversations that start. It's not the easiest thing to do. I know how hard it is to open your mouth and start talking about the stuff
Yeah.
that's really bothering you. But once it starts, and then you realise there's other people with shared experiences. It's powerful stuff. So that's why this podcast is such a powerful platform. People can tune in, they can listen to people having real conversations about real life
it relates
issues.
to them, doesn't it?
Right? But we're all experiencing
We
life,
relate to
aren't we?
them.
You know, it's tricky times we live in.
Exactly, and they relate to them. And thanks to MPM the day, giving us this platform to highlight mental health issues in the construction industry, highlight the podcast where you can actually go and just listen to guys here, Ray and Sam, who've lived that job, lived that life, and they've come out at the other side. Any more advice, Ray?
Talk. If you are struggling, reach out and know that there's people out there that want to help. Talking is the first step, and it's the hardest thing you'll do is talking about things that are troubling you, but it's the most powerful thing you'll do.
Thank you very much.
Thanks, mate.